Welcome to the Dental Breakdown Show with Christian White. Mr. White is the CEO of White & Associates Practice Consulting. Better business, better dentistry. This podcast strives to help break down the current and everyday issues within the dental industry. In each podcast, we discuss a topic on dentistry with respected industry professionals, dentists, and other relevant special guests. Our goal is to help provide you valuable insights for your dental practice. We thank you for listening today. From the dental chair to the beach chair, wherever you are listening, sit back, relax, and enjoy the Dental Breakdown Show. Now take it away, Christian.
Let's welcome our guests to the podcast today, Haley Dollins and Liz Kingstedt. Thank you so much for being guests on the Dental Breakdown Show today.
Our pleasure.
Well, thanks, Christian. Thanks for having us.
Thank you so much today, guys. You guys have got some great information to share. I am excited. I think you're going to make a really big impact in the dental community today with what you guys have to share. So let's go ahead and get started. So Haley, why don't you start out first? Maybe give us a quick little bio and tell us a little bit about yourself.
Yes, well, I am a dental hygienist of 20 plus years, and my background comes from a variety of specialties. Worked in periodontics and pediatric dentistry. Worked in the hospital setting at HCM. I was in a variety of general dental settings, and I owned a dental temporary staffing for 15 years here in Minnesota. So my background is a lot to do with loving prevention and what we do to deliver the best patient care and delivery system to our patients. My role here in Mill City Anesthesia is I work as the business development manager. And really my role is to be the dental interpreter from the medical model that we work in to the dental model that the setting that we're working in. So working with our practices, the administrative staff, as well as the clinicians, and understanding what kind of anesthesia we provide at Mill City, and being that liaison with our clinical staff as well.
Okay, great. Liz, why don't you go ahead and tell us a little bit about yourself?
Thanks. I'm Liz Kingstedt. I founded Mill City Anesthesia in 2020, and I continue to serve as the president and the chief CRNA of our business. I am a nurse anesthetist. We're also called CRNAs, and I received my training at St. Mary's University of Minnesota here locally. Prior to starting Mill City Anesthesia, I worked at a local children's hospital for 6 years and specialized in pediatric anesthesia. I've also done an extensive amount of adult work. Before I was a nurse anesthetist, I worked as a registered nurse in Washington and Montana, doing emergency room nursing, as well as working in the intensive care unit.
Wonderful. All right, that's great background for both of you. Now, tell me a little bit about how you both got involved in this crazy world of dentistry. There's got to be a story for both of you, and I can't wait to hear it. Liz, why don't you go first, and then we'll hear from Haley.
I first learned about dentistry when I was working at the children's hospital locally, and I saw many different types of surgical procedures there. One of them was restorative dental work, and that's when I was first exposed to kids' oral health and where anesthesia fits into that picture. I see the great benefit that anesthesia brings to that patient population as far as dental work, but the hospital didn't seem like a great fit for a lot of the patients. It's notoriously noisy, overwhelming, tends to run inefficiently, many sick people in the hospital, think during COVID times. And I thought, there is a better way to do this. And that's where the idea for Mill City Anesthesia was born.
Okay. Haley, go ahead, please.
Yes, so as I stated earlier, having a background as a clinician in pediatrics, I had the experience in working in the OR and working at HCMC over the years too, at our local level of trauma hospital, was seeing a lot of children and pregnant women. And again, saw a lot of those same things that bring, but also saw that the dental setting, especially for children, but for adults as well, dentistry can bring a lot of anxiety and concern And so the ability to be able to work in a dental setting and keep patients in their dental home is extremely alluring, right?
Mhm.
And also watching the dentists that I work for in a private practice setting in pediatrics, where they were using half of their day just to go into the OR with one child or one adult patient. Maybe they're seeing two patients and they're spending half their day there. So it also left their dental team with no dentist for exams or not being able to see patients in the scope of practice for the providers that are still there. So those were the things that kind of made me go, okay, this is a great way to treat patients, but is it the best thing for the dental practice and the best thing for the patient as well? So fast forward about 15 years of working in about 1,200 dental practices in Minnesota on a temporary staffing basis. I had left that company and sold it. And when I did, I had both Liz and another colleague of hers approach me and say, hey, we have this idea, we're moving forward, we're going to be providing mobile dentistry, mobile anesthesia in dentistry. And how would that look? And for me, it made me super excited because I knew that the need was there. And again, having seen it 15 plus years ago, fast forwarding to now, it's like, this is an opportunity, especially given COVID, where we can keep people in their dental homes, create opportunities for them to stay there. And of course, provide an opportunity for dentists also that maybe have chosen not to be in the OR to offer those anxiety-free appointments for their patients as well.
Wonderful. I'm going to ask this question. You've talked a little bit about this already, but, Liz, maybe tell all of our listeners directly exactly, Mill City Anesthesia, who are you? And just maybe give a little bit more focus on the company real quick.
Sure. We are the turnkey solution for the dentist who wants to offer sedation and anesthesia services in their office. So they no longer need to, private dentists do not need to refer out their patients to specialty centers or hospitals. They can keep their patients right at home in their dental chair, and we can come to them with all the medications, equipment, and staff needed for safe anesthesia at their office.
The Dental Breakdown Show, sponsored by White & Associates Practice Consulting. Better business, better dentistry. They are a practice management and consulting firm for dentists and other healthcare-related businesses. Their sole purpose is to implement proven strategies through online and practice visits that result in the personal and professional success of the dentist and his or her team.
This is Liz Kingstedt, owner of Mill City Anesthesia. We take away the pain of dental sedation and offer a turnkey approach to anesthesia care in the comfort and convenience of your own office. Our patients receive safe, individualized, high-quality care at every appointment. While they may not remember their dental procedure, they will remember to tell their friends about the wonderful experience they had at your office. If you would like to expand the services that you offer to your patients, give us a call today.
The next piece, Mill City Anesthesia. You're working with private dentists. Tell me about the impact that you're making when you work with the dentists and you work with their patients. Because if I'm hearing you guys right, this is just a great idea, and it's got it works. I mean, if I was a dentist, for heaven's sake, sign me up.
Absolutely. Well, I see our dental clients falling in one of three categories. The first is a dentist who does not offer any sedation services at their office. I think that our service could bring new clients to you. I see a major trend in the market of patients who are looking for sedation services in their dental office. So without the private dentist needing to prepare to get their own certification to provide sedation, they can just bring us in and we can take care of it. The second category of dentist would be someone who is currently taking their patient to a hospital. The reason I think they would rather have us come to their office is they can control their own schedule, they can work with their own staff, their own equipment, and we are much more efficient than Haley was alluding to that, than spending the day at the hospital for patients. And lastly, there are dentists who are currently providing their own IV sedation in the office that do use our services. Perhaps they bring us in for a case that they're uncomfortable with, something particularly challenging, or it's a complicated surgical procedure that they don't feel that they can give enough attention to the sedation as well. And they feel more comfortable having a certified anesthesia provider there watching and monitoring the patient.
Mhm. Okay.
I think for the staff, it creates an opportunity too, to not feel like they've, well, for the dental team, application plan, because of course, we're all in dentistry to serve our patients, but at the end of the day, it is a business. So not having to refer out from a general dentist standpoint, to be able to keep those things and treatment plans in-house makes the patients much more comfortable, which of course in turn then means they're telling their friends and neighbors about the fabulous experience they're having. But also to be able to streamline that for the dental team and allow them the ability to all continue to work, as Liz said, in their normal practice, in their normal operatory with all the same equipment, and really not add any additional time to that procedure as well. In fact, we see some of our doctors say it's taking them less time because they're not having to wait on the anesthesia from the local anesthesia standpoint. They're not having to wait the 10, 15, 20 minutes or doing multiple injections because maybe the first round didn't work as well as they hoped.
Mhm.
We get to start going, and even if they choose that to still use it, they don't have that.
So I think it's, you guys have to tell me this, but I think it's fair to say that you guys are in the experience business. You're not in the business of administering anesthesia. I'm being a little funny. But the experience that the dentist has with you, that his patients have with you, is huge.
Yes.
I think it's almost more important than the clinical care. I'm being a little funny. But I mean, patients will go someplace where they have a really good experience and they feel good. And it sounds like you guys have that nailed in terms of the experience piece.
Absolutely. I'm so glad that you bring that up, because of course, safety is our number one priority and the clinical aspect is extremely important, but the patient experience is really what makes Mill City special and makes us different. We truly and genuinely care that the patient has a good experience. That's what will keep them coming back to the dentist's office. We work with many phobic patients. Most people haven't seen the dentist in many, many years. And once they hear that this is an option for them, dental care becomes much more accessible. We want every patient to feel well cared for, prepared, supported, and we get to know every patient as an individual.
Mhm.
So that's something that makes us really special.
Yes, part of what we do is really following the patient from the moment that the office calls us and tells us, we have this patient, it's going to be this type of procedure. We're doing extractions, implants, restorations, scaling and root planing. They give us that patient information, and from there to contact them, the office gets to really be hands off. Our approach is really to be able to take that burden off of the practice and to take that on to get to know the patients, because that is our first opportunity to get to know them. They serve the patient for anywhere from 1 day to 4 decades. So for us, we get to then take that burden, call the patient, be responsible for not only the communication, but the relationship building with that patient. And it starts in that first phone call. They're meeting with the provider who will provide their treatment. They're getting to know them. We get to know them also as a human, not just a mouth or a patient. And then that way, before they come in, during their experience and follow up after, we are following along with what's going on. It's not the burden of the practice to do. Of course, they are responsible for the dental procedure and they can definitely be following up and do. But we like to be the ones to be able to follow up on behalf of the practice, really to model that integrated medical dental model as well. To show, we care about these patients. We want to make sure that they're not just being carted out the door, but that we're following them and making sure as they get home that day and the next day as well, that they feel cared for also. And I think that really shows, because we have many, many patients who are going, can we give you a Google review? Is there somewhere we can tell other people what's going on? I've never experienced anything like this. And recently we had a parent say, I've never experienced anything like this, and we've done this before.
Mhm.
So really the heart of where we're at, is to serve patients, because that's what it's about.
I would say that, in the dental business that we're in, patients look at value much different than the clinical dental team looks at value. For a patient, it's how much time did someone spend with me listening to me? And I think everybody, you included, and everybody who's going to listen to this podcast has had a bad experience at a medical practice because the doctor comes in, he says two things, he or she leaves, and you're like, excuse me, you didn't even ask me my name. It's not George. It's sorry, you have the wrong, so people leave with a bad taste in their mouth. But in the dental world, we have a chance to, get to know the patient, find out some things about them and take some time to get to know them. And that's where the whole experience piece comes in, but that's also where the trust piece comes in. If somebody was to treat me like that, of course, here, sedate me, do whatever you want. Take all my teeth out. I'm being funny. Okay. Please don't do that. But no, but I think you guys understand. Yeah.
Yes. Yes. We frequently hear from patients, I will have a consultation with a patient ahead of time. I'll spend as much time as it takes for them to feel comfortable, to gain their trust, to make sure that they understand what's going to happen on the day of the procedure. And then when I see them day of procedure, they're almost kind of at ease. And I know that they're recognizing that they've already spoken to me, they already know me. And then I'm also going to be the person checking on them later. So it's more of an individual to individual relationship than the patient with a big system.
Mm-hmm. It makes perfect sense. In the medical world, I'm going to say this, it's difficult to find that sometimes. Yes. That patients like to have their hands held, and be told, here's what's going to happen, here's what we're doing, here's why we're doing it. Oh, and by the way, here's how it's going to really positively affect the rest of your life because you're going to have these procedures done.
Yes.
And I think you guys have that part absolutely just nailed down. And if the dental team was paying attention, they could probably learn a few things from you guys. There are a few offices where I think you guys need to go visit, just to go say hello.
They can give us a call. We'd love to help.
No.
Carried us wherever we go, because
that's right.
Part of what we do in dentistry too is rubbing elbows with the dental providers and re-energizing these teams, because I say every day, if I didn't do something that I loved, I wouldn't be here doing it. And
correct.
So to spread that joy and that excitement, that electricity, really takes rubbing elbows one person to another, right? And saying, we love what we do, and we know you do too. So let's let it show.
Mm-hmm. That's
I also
awesome.
want to point out that the excellent care that we're giving to the patient is not for the patient to remember Mill City Anesthesia was awesome. It's for them to remember that they got great care at their dental office. So correct. We are trying to represent the office and the dentist that we're working with. Well
said. Very important. Yes. So let me take a little bit of a right turn for a second. Okay. Mill City Anesthesia has a new patient process, just like in the dental practices, we have a new patient process we follow. Tell us a little bit about that. How does things work when you start working with a new client? I think it's important for, all our listeners to know that.
Sure. So when we receive word of a new patient from a dental office that's looking for our services, yes. They are contacted with a welcome message from us and a link to self-schedule a consultation with a staff member from Mill City Anesthesia. So we try to be very simple with our communication, and we don't want to make this very complicated. And so this is on the patient's time. They choose the time and the date. We will give them a call. We'll spend as long as we need to talk about their dental history, their medical history, how we can help, and what their expectations are. We have our patients visit their primary care provider to get a physical to make sure that they are fit for anesthesia. That is the one piece that the patient is responsible for. And then we send them a reminder the day before their appointment with instructions on preparedness for the day. They can reach out to us via phone call or even a text message at any time, and we get back to our patients very quickly. And then we meet them on the day, discuss a little more, take care of their treatment, and then we will help them to their car at the end and check up on them later that day and sometimes on the next day.
I say this lightly, but also very seriously. I think one of the things in dentistry, at least I'll speak for myself as a dental hygiene provider, when we think about what anesthesia looks like to the patient, maybe a different patient in the waiting room, watching the patient come out after or hearing what's going on behind a closed door in the back. It's often not a picture that's painted well in your mind, right? It's not a positive experience. And so one of the things we talk about with our offices and what to expect when I'm talking about, training the dental team, it's a conversation. Again, we know these are intelligent dental providers, but doing anesthesia can be a new experience and something different. And so one of the things that I always say is, the Board of Dentistry requires that we have a wheelchair here to wheel the patient out. But I think it very quickly paints this picture that we're going to have this half comatose, patient that's being wheeled out the back door because no one wants to wheel them through the front lobby. And of course, we've all seen the YouTube videos, right?
Yes.
Teenager post wisdom tooth extraction in the backseat, telling stories on, what happened. And they're usually untrue, right? But they're great wild stories. And so that's one of the things I can talk about with our dental team. This is what to expect. When the patient's done, they're going to rest, they're going to recover. But the way that we do our medical care and our delivery of the anesthesia, these patients, while they may still have some really sweet amnesia of this experience, they're alert, they're awake, and they have their faculties about them. So it's not this picture that I think we all think in the back of our minds of, having to be leaving someone in a car and driver driving them off. Most of our patients are very aware of what's going on. And, but of course, for the safety, we have someone driving them home. And I think that picture of the end result is often what we all think of the whole anesthesia picture. So it's part of what we really describe to our dental teams too. That's not the picture that we want to be painting because it's not usually what that looks like.
Haley, it's important that you said that. I'm glad you said that because when you say the word anesthesia, the first thing I think of is the last YouTube video I saw. And this, person in the back, and they're talking about aliens landing, and they saw, Tom Cruise, they saw that at the chair. I'm like, really? Wow. Okay. And so, but I think it's important you say that because patients need to know that if they're going to have this done, and if they're going to go through this process at the end, everything is going to be okay. They're going to be okay. And people need to know that because if they know that, then all of a sudden, the fear begins to kind of subside a little bit of having this done. Do I do it? Do I not do it? Do I just live with the pain? I'm really happy that you said that because as a potential patient, that makes me feel better. And on top of it, the fact that someone is going to walk me to my car, that's a big deal for anybody. Doesn't matter how big a person you are or, it's nice to know that somebody cares.
Yes. And that's part of our patient experience and also our dental provider experience. So that we also are often not a one single team coming in. While that may be all that's required, we're bringing up to providers into our practices because we want to make sure that everyone is at ease. The patients are at ease, but also the dental providers are at ease. Their team knows that while we've never had a medical emergency and we plan and plan very safely and accordingly to never have one, that things happen. And if that does ever happen, that we have the whole team there to take care of those things. It's not, hey, now I need you call the code or you do this. It's our team is there, that Mill City team is there to be able to handle whatever comes our way. And so it's creating a good patient experience. It's also creating comfort and stability for the dental team that we're working in because, as we said, we're representing their practice. It's their name in the community, and our goal is to be their only.
The Dental Breakdown Show, sponsored by White & Associates Practice Consulting. Better business, better dentistry. They are a practice management and consulting firm for dentists and other healthcare-related businesses. Their sole purpose is to implement proven strategies through online and practice visits that result in the personal and professional success of the dentist and his or her team.
This is Liz Kingstedt, owner of Mill City Anesthesia. We take away the pain of dental sedation and offer a turnkey approach to anesthesia care in the comfort and convenience of your own office. Our patients receive safe, individualized, high-quality care at every appointment. While they may not remember their dental procedure, they will remember to tell their friends about the wonderful experience they had at your office. If you would like to expand the services that you offer to your patients, give us a call today.
So now let's talk about something completely different, right? Here we are right now. It's February already in 2023. Talk a little bit about some of the trends, that maybe the top 2 or 3 trends that you guys are seeing in the dental marketplace, and then how is that kind of, how is Mill City Anesthesia kind of weaving its way through those challenges?
Well, for the trend that we are here seeing the most is that many patients are specifically seeing dentists who offer sedation services. We see it all the time. I just last week took care of a patient who lived an hour and a half away from the office that I was caring for her at. And I said, hey, why are you, there's a lot of dentists closer to you. And she said, I Googled sedation dentist, and this was the closest one.
Wow.
Okay. So, we know that patients come to their dentist for our services. And office-based anesthesia is becoming more and more mainstream. And the word is getting out that you don't need to be uncomfortable with the dentist anymore. And that's bringing a lot of patients back to their dentists. We're really happy to be a part of that. I think that we are the solution for this trend.
Yes, not only that, but we are seeing a large number of patients that are contacting us saying, oh, you guys provide sedation. Where's your office? We say, well, because we have this office here and this office here, because we partner with dental providers in your community. And to us, that's really, really important, because just like dentistry has had to work through that hurdle of going to where the patients are in public health dentistry over the last few decades, of really reaching out to those patients, and in Minnesota specifically, we've been cutting edge to that. And it's been necessary to meet the needs. And so this is a process for anesthesia to do the same thing.
So if I'm a dentist and I have, a difficult case, or the sedation piece, I'm hearing more about that, do the dentists normally contact you guys? Does the front desk person just call you and say, hey, guess what? This is Dr. Smith's office. Can you be here next Tuesday at 5? I'm a little curious.
Go ahead, Haley.
Is what I would say. I had a dentist tell me about a week and a half ago, she's like, I was at Rosedale Mall flipping through Facebook while I waited for my Caribou coffee, and up pops this post that I see about Mill City Dental Anesthesia. And I say, I need this. What is this? And they're about an hour north of the Twin Cities, and we're seeing their first patient coming up here really soon. They immediately had 3 patients in their mind. So these are the patients I know need this, that I can't see them, and they're not going to drive to the cities to have that done. We're seeing patients as far as Grand Marais, I think, is our farthest office right now. While we're not all over the state every single day, we are primarily in the Twin Cities. Patient care and delivery of that care is so important to us that we want to make sure that we are going where that's needed. So when offices call us, it can be the front desk person calling, it can be a text or an email or a LinkedIn message or on Facebook. They come in all over for us. But again, our goal right away is to keep things simple. We know that it's a big step to consider letting another provider into your practice.
Mm-hmm.
So we want to make it comfortable. We want to make it simple, and we want it to not complicate what they're doing already. So whatever that is, we offer the ability to go over it on the phone, to email a follow-up that has all that information so that it can be shared and disseminated at a team meeting or with another doctor, an associate. But also we offer the opportunity to come in and meet with the doctors and admin team, or to meet with the whole staff. Both Liz and I have an education background. I have a master's in dental education, dental hygiene ed, and Liz also on the anesthesia side. And so for us, it's really important that we're educating. So for offices that say, hey, we want to know more, we want to understand this a little better, or make sure our whole team understands it, we've gone in and done even up to a couple different trainings in larger offices where everyone's on the same page by the time they're seeing patients. And we've had some after a while that say, hey, can you come in and do this, because we see the need and the patient's asking. We can't figure out why it's not following through. So maybe it'd be good for us to train a little bit to understand the verbiage and the scripting we want to use with our patients. Not because we them something, but because we want patients to follow through with what their body needs. And if anesthesia is a way to get them to take care of their body and their health, then we want to do it.
Okay. Yeah, as a dentist, having somebody else work on your patients, it can be a very stressful ordeal.
Right.
That's you don't just let anybody walk in the door and say, "Hey, I'd like to meet your patients." Sure, I'm being funny, but no, you don't do that. So the ability to walk over, drive over, see you, meet the two of you, meet your team. This is how this is going to go. It's your own consult to the provider, just like you would give a patient.
Exactly.
Yes. And I think too, for the specialists that we work with, which is the majority of our offices, they're bringing us in because they feel that way going into an OR. Hey, I have
Yeah.
this case I can't do in the office. I would normally go into a surgery center or a hospital to do it, but that means I then don't have the equipment I want, or I may not have my microscope, or I may not have that available to me, or I have to make sure it's there. And is it going to be what I need when I get there? So
Mhm.
again, providing that autonomy for the dentists that they have in their own practice while providing and supporting them as well.
Great. It's all wonderful information. Thank you for sharing that. All right. So we're getting down to the end of the podcast. And this is the most favorite question everybody enjoys and loves that I ask. Okay. So get ready.
Okay.
So Liz and Haley, if you don't mind, please tell us maybe a little bit something about yourself that nobody else knows.
Well, I'm not sure no one knows this, but probably none of your listeners. I am a hobby beekeeper, which
Wow.
is kind of a unique hobby. I like to unwind at the end of the day by visiting tens of thousands of honeybees in my property. And I am a gardener, and I like to watch the way that the bees impact my garden and the food that I feed my family and how it all works together. And I give honey to all my friends and even the dental offices. It's just a fun hobby.
That's got to be really great honey.
Oh, it is really great. It's fresh.
It's fresh. I was just going to say, yep.
Yes.
Yes, I'll attest to that personally. Well, I know we're talking about dentistry, so it's a little cliche to say something. One of my secrets or things I love the most is in dentistry, but I've been really blessed to be part of a dental community and family that I absolutely love. And so one of the things that I set out as a dental hygienist in undergrad was the idea of treating patients beyond the four walls. And so I had the opportunity to go to Honduras as a dental hygiene student in undergrad. It's actually what made me decide not to go to dental school and stay in hygiene because of that time frame. Really getting to treat patients and the time as hygienists that we get. And so one of the things I got to do a few years back was take a trip to Bolivia and work on the Amazon River on a riverboat, live, sleep, work, and eat on that boat for 2 weeks. And everything was by generators. So no, I couldn't call my family or check up on the news. But on that trip, the interesting fun was that we had pink river dolphins, but we also had piranhas in that water. Not only swim and bathe in that water, don't have a cut or leave any blood from the patients on you, right? But also got to eat them for dinner on many occasions as well. So it has spurred us on to start a dental clinic at an orphanage in Mexico. And that is, to me, those are the things when I'm laying in bed at night, those are the things I'm thinking about as I drift off to sleep, is the fun and the joy of getting to share what we do. And again, not meant as a cliche answer, but again, I feel really strongly that if you love what you're doing, then it's not a job, it's a gift, and I love that. So while my dental family around me may know that passion, it's definitely something I always tell people, don't have a bucket list to do someday. Start checking it off and live the life that you've been given fully.
Great. Both of you, that was great stuff. We got a beekeeper and we have someone who goes around the world, changing lives by doing dentistry. This is awesome. It's great. All right, Liz, Haley, thank you so much for being on the Dental Breakdown Show today. This has been awesome. The information that you shared was beyond impactful today. So for all of our listeners out there, more than likely they're going to want to know more. They want to know how to contact you. Where can you send them?
Sure. You can visit our website at millcityanesthesia.com. And we also offer the free lunch and learn that Haley mentioned. So if someone just in office wants more information, wants us to come in during lunch hour and do a free CE for them to talk about in-office anesthesia, we're happy to do that.
Thank you for listening to the Dental Breakdown Show with Christian White. If you would like more information about today's topic, have a topic suggestion, or would like to be a guest, please check out the description below. Or for more videos, podcasts, and information, please visit whitedentalconsulting.com/podcast. If you liked the podcast today, please press that like button, subscribe to our channel, and hit that notification icon to become a part of the growing Dental Breakdown Show community.